Hi, I'm Dr. Martha Calihan from Five Stones Wellness. We're going to continue this discussion on stress. We've been talking about what stress is, what the normal stress response is, what an exaggerated stress response is, what happens in our bodies when we're under perpetual stress. And now I'm going to talk about some ways both to assess that and also to help treat it or manage it differently. So one of the things that I like to do in my practice is to offer people a chance to have their cortisol levels measured, because that can be a reflection of the amount of stress that is happening in the body. Cortisol is secreted by the adrenal glands that sit on top of the kidneys, the emergency stress response system, so that when we are under stress, our cortisol goes up. And if somebody's pattern over a 24-hour cycle of cortisol is out of range or an abnormal pattern, it gives us a clue as to what's going on and where we can act to help mitigate those symptoms. Most of the time, or at least much of the time, people can't easily change their source of stress. A lot of the stressful events, stress things happen to us that are outside of our control. But I always like to say that we have a choice as to how we can respond. And if we can change how we respond, that can begin to change the physiology and how the effect of stress chemistry is played out in our bodies. So part of that is learning some mind-body medicine skills to help us not be pushed so hard by the stress. We were talking earlier about resilience. And if we practice some of these mind-body medicine skills, we can actually build up our resilience so that we're better able to withstand the normal stresses of everyday life. One of the best ways that I know to do that is to use our breath. It's a tool of mindfulness, which is near and dear to my heart. But I love working with the breath because as long as we're alive, we always have our breath with us. There are no special tools, no cost to do it, nothing other than what we have. Mindfulness is a technique of being totally present, right here in this moment, in this body, in this space, in this moment. When we are totally present, we can't be in the future in worry or in the past in regret, because you can't be in two places at one time. So if we can train our brains to settle into the present moment and focus completely on the present, and you practice that, eventually you realize that the body has responded in a calming down. The heart's not pounding as hard, the mouth is not as dry, the butterflies in the stomach can go away. Those stress responses can be minimized by practicing mindfulness. And I love to do that with the breath, because if you focus on the inhale and the exhale and put all your attention and focus on inhaling and exhaling, then all the chatter of the stress around you and your body's stress response goes down. It's probably the best tool that I know to help us deal with an exaggerated stress response. And as I said, we have it with us all the time and can use it anytime. There are also other things that we know that help with stress physiology. Nutrition's important. We want to manage a blood sugar so that we're not adding to physiological stress by shifting blood sugar levels. That's just hard on the system. Eating protein every couple of hours is a great way to mitigate that. And then there are supplements that people can use that are very helpful in helping address stress, much of it through the cortisol system. There are herbs like ashwagandha or withania, holy basil, which is also called tulsi. Magnesium is very helpful for stress. If people have low cortisol, sometimes licorice is a helpful tool, not the candy, but the herb. People need to be careful with licorice because it can affect the blood pressure. And holy basil or tulsi You need to watch blood sugar if that's an issue for you, because that can have an effect on blood sugar management as well. So there are a number of tools that we can use to help with that stress response. And if we can get on top of the stress response and manage it a little bit better, then a lot of the physiologic symptoms that are driven by an exaggerated stress response can be improved. So it is true that stress contributes to our symptoms and certainly can be the driver of them, but I don't think it's great to stop there. We want to go ahead and deal with why and how to help change that. Another really good tool for helping to manage stress is exercise. With the caution that if somebody's dealing with a lot of stress response, illness, or symptoms, that's probably not the best time to over-exercise, but gentle exercise. Whether you go out and take a walk, whether you do yoga that's more of the restorative yoga. There are ways to help move your body and get that effective exercise without really overdoing it. It's probably not the time for high-intensity workouts if you're extremely stressed. And there are people who really use the exercise to help manage the stress. So that's always a challenge, right? It's got to be balanced. But exercise is a fabulous way to help mitigate stress. Obviously, sleep is another excellent thing to focus on when we're talking about stress. One of the challenges is that stress can affect sleep and cause a very disrupted sleep pattern. So that really needs to be addressed too. All of these tools together are going to help strengthen our ability to be resilient and to thrive in the setting of stress, and hopefully not be overwhelmed by the effects of chronic stress in our daily lives.